in order to access some of the things that we need for digital radiography, we're going to go ahead and click on, there's a couple of things. So, and if you can all try to get a look at the screen, because this is what you're going to want to know. So let's kind of squeeze in there, pile up. Okay. So there's actually a couple of things. We're actually going to be working through this application called Dexis. But the way that we're going to access it is not through here. It is through this chair kind of a tab right here. So we're going to go ahead and click on that. And then I gave you all passwords already. So let me, and then it gets you into this particular area right here. Okay, so, and we can follow this portion of it right here. So you're going to get into Enterprise. You already entered your user ID and your password. And at the initial beginning, I don't know if you saw, I typed in DA because dental hygiene has their clinic too. So there says dental hygiene. So you want to make sure that you're actually physically typing DA to get into yours. So, so username, password, and then DA. And then we're going to click on the family file, and that family file is this little icon right here, and if you put the cursor over it, you can see where it says family file, and it actually has like a couple of people with the manila folder behind it. So we're going to click on that, and then where's it at? Okay. Okay, then we can click on this little icon right there. So if you want to add that to it, I don't know if that is on there or not, but add this icon, and it is a little man with a little arrow to his right side. Okay, you guys okay now? Okay, so our goal right now is to go ahead and actually make a file for each one of you. And this is the last time you have to actually make one file for yourself, okay? So if you make a file for yourself right now, and you make a file for yourself, and let's just say that you both require x-rays in the course, and you decided that you were going to be each other's patient for the thing, you don't have to make another file for this thing. You don't have to make another file. It's already in the system, okay? So that's what we're going to do, is we're going to create a file for each one of you, and to do that, we're going to click on the new patient family right here at the bottom, new patient family. So I'm going to have you click on that, and then we have this head of household information, and you want to make sure it says head of household. You are the primary focus of all of this information that's right here. So for the personal information, I just need your last name, your first name. You can put your middle on there if you have one, and then your birth date. We don't need your social security number or anything like that, or your driver's license, so you can leave that personal information off. We do need your contact information, and this won't take your information at the very end unless you put in your email address. So you'll have to do this for every patient that you put in there. So put in your email address. We okay here and here? Okay. Then the demographics. You don't have to put in anything that you really don't want to on there, although at the very least you're going to probably want to put on just your sex, marital information, and that's pretty much it. And if you want to do a deep dive and do all these, you're more than welcome to. It's fine, especially if you're a veteran. Any veterans in here? No? Okay. Don't need to do anything with communication. Okay, so I'm going to go ahead and just let you fill this thing out, and I will go over this after all that, because this takes a little extra tutorial on there. So go ahead and complete the personal, contact, and demographics. Okay. So when it comes to the provider information, we have our clinic is DA, and then we're going to click on the side menu for that, for PROV1, and then we're going to click on there. Nothing really comes up, so we have to click on all providers, and then press OK. Oops. Let's go back here, all providers, and then we're going to click on this little side menu right here, and then it'll pop up. And then we are CYPDA right there. Okay. Does that make sense? Mm-hmm. Okay. So then we click OK, and then that's in there. If all of this is done and this is complete, we can then press OK. And then when you do that, all your information goes up here as a regular patient in the system. Okay. Any questions on that? Okay, go ahead and complete that. Let me know if you have any problems. So we are going to add family to your profile. You are the head of household. So in essence, think of this as you're as the parent, and then you're putting your family in there, siblings and things like that in there, you know, kids. So we're going to add right here, and there's an icon. There's an icon right here that says, it's got a person with a plus on it, and then if you put your cursor over it, it says add new family member. So we're going to click on that. And a lot of your information is already going to come up with it, your address and some of this other information that you have, including this, that you don't have to put another information as far as who the provider is. But to distinguish what you guys are working on, we're going to put the name of what you're trying to do. So what are we going to be doing today?
Bite wings.
Bite wings. So we're going to put BWX, and then what's the technique that we're going to be doing? I love this because I'm going to be saying this over and over again.
Starts with the B as well.
Bisecting. And the other technique that we're going to learn later? Paralleling. Okay. So you're going to be doing bite wings, and then you're going to be doing the, maybe I'll put it right here, bisecting right there. Okay, that's pretty much it. That's all you have to put in there is bite wings, bisecting, for your patient's name, and then if you want to, just for, you know, entertainment purposes, you can change the sex of your kid, okay, and put that on there. So so everybody go ahead and add a patient to yours. First name, we're all going to have the same kid's first name. Bite wings, bisecting, okay.
Let's see.
Okay. Okay, so every time we do a new set, whether it's my class or you got somebody else's class for it, and we're doing this thing, so the next set that we're going to be doing is a full mouth series, or FMX. Full mouth series or FMX, and you would basically put for the first name FMX, and then the technique is still the same because we got to complete that technique, and it's bisecting. And then you'll have another kid under there, so, and you'll have 4 kids under there, so they'll be right under your name. For that. Okay, are we good so far? Mm-hmm. Okay, now let's get to the actual, let's take some x-rays thing. So once you get in your file, always verify at the very top of this thing if it really is a patient you want, because we've had students that they thought they entered in the name, they started taking x-rays, then we realized at the very top that it wasn't even the patient that they wanted. It was somebody else, you know, and then, and that's when things get really kind of crazy, because we have to do some undoing, sort of, if we can. So now that we have verified, we're going to click on this tooth, and it says patient chart. Okay, so this is now accessing the window that we need to actually take x-rays. So we're going to click on the patient's chart. And then this menu will always pop up. On a real patient, comes up in dental hygiene with their patients all the time. Every time a patient comes in, we want to know, did their health history change in any one way or another since the last time they were there? We don't need that for our purposes, so we're going to go ahead and just X that out. And then we're going to click on this icon right here that sort of looks like a little X-ray film or an X-ray image. It's right by the number or letter or the number X. We're going to click on that. And give it some time because it's a little slow. So we're going to click on it and allow this thing to come on up. I don't know. That's a good question. I think we're just using it as like a reference. So I'm gonna go ahead and X that out, X that out, X that out. And we are going to take, and this is really important too because it really shows what it is we're going to be taking. If you click on any one of these other ones for some x-rays, it's going to show up in a different way. This one is pedo, but we're not doing pedo. Vertical bite wings, we're not going to do that yet, but we are doing bite wings. So we're going to go ahead and press on bite wings. And I want you to notice what is highlighted.
The central teeth.
The central teeth. So in regular dental offices, whenever we do a checkup set on your patient x-rays, we always include generally 2 PAs on the anterior, one on the upper, one on the lower. We talked about, or I mentioned PAs, I'll go into that more detail later, but PAs, periapical for the upper, an x-ray on the lower, which is the same thing. But for our purposes, the dental board does not require that. So we are going to go ahead and press next. You notice it goes to the lower one. We don't need the anterior, so we're going to click again. And what side is it asking us to take?
Right side.
It's perfect. It's asking us to do the right side, and you want to get used to that that whole setup on how that is. When you're looking at the screen, you're looking at as if you're looking at me. This is my right side, so that's on there. I also want you to notice that these upper teeth are lit up and these lower teeth are lit up. It doesn't matter that the canine isn't highlighted because all it's telling you is that we're doing a premolar picture. It's your job to include that canine in there. This doesn't matter whether it's highlighted or not. This is just their icon, or however you want to say it, their look to say that we're taking a premolar picture. If for some reason you accidentally hit it and it's doing something else and you want to get back, all you really have to do is just hit that button right there in the middle and it lights it up again, okay? So your setup should look similar to this, but not quite. So I'm gonna take this off and I want you guys to see it. So we have the tab currently. If I kind of go to the side, you're gonna see, I'm gonna show it to here, then I'll show it. So on this tab, the tab you can see is set higher, so you have a little piece on top and you have more on the bottom, so your bite will not be even. You'll get more of one arch and not enough of the other one. The other thing is the tab is not on the plain side, it is on the side that has the cord. And it's okay, this is our learning, this is how we learn from that. So I'm gonna take this off and then I'm gonna wrap it on the other side. So that tab should actually be on the plain side, and then I'm gonna bring it over here, and then I'm gonna go ahead and pinch it to the best of my ability down the center of that as possible. So I have an equal amount on top and I have an equal amount on the bottom, okay? I will tell you that this cord or this styrofoam bite wing tab, as you start to use it, will start to move. Even from when you do your premolar to your molar, it'll start to kind of move, it'll stretch, it'll do kind of crazy things, and you'll have to readjust, or you'll get what's called inadequate margin problems for that. Okay. So, can you click on the back of that so I can kind of see, make sure I'm still in line? Good.
Remember to show it to the camera.
Yeah, so this is the final, thank you for saying that. This is the final product, so we have an equal amount on top, we have an equal amount on the bottom, and the tab is now on the flat portion of there. So I'm going to take this, I'm going to put it right back on here just in case I make any mistakes. It's going to fall not to the floor. And then I'm going to sort of have you guys help me out a little bit with this. we're taking a premolar picture, right? So what tooth do we need to include in this picture?
The canine.
The canine. From the maxillary or from the mandibular? Oh, are we referencing, which one are we referencing? The upper canine or the lower canine? Only one. The lower. In a normal bite, we are just doing the lower. Why? Because that lower canine in the normal bite is more anterior. It's more forward. And if you only reference the upper one, we'll lose the lower. Okay, so we're going to reference, and the only time that changes is when the lower jaw is like this, class 3. It's a class 3 bite. Then we reference, no, I'm sorry, the other way around. Well, if the upper jaw is more forward, then we're going to reference the upper one instead. Okay, so we know what we need to get. So we're going to take the patient's tongue. We're going to move it out of the way. We're going to take this, place it in the patient's mouth at the best of you can at a flat. We're going to rotate it in the patient's mouth. Now, I'll tell you that this black sensor is a lot harder to see than your normal film. It just is. So, so you want to make sure that the side of this completely covers your canine. And from right here, if I'm standing right here, and notice I'm not standing in front of the patient. For so many reasons, I'm not standing in front of the patient. Okay, that's my cue to walk around the other side. Okay, I'm not standing in the front of the patient. I'm just staying on the side that I'm working on. And I'm going to go ahead and close this patient. How?
Slowly.
Slowly. All the way. I'm going to rotate my finger to the buccal. This patient's going to close down all the way, and not until that patient closes down all the way. I'm just going to keep my finger on until that's done, and then I can take my finger off. What 3 things do we have to do?
Parallel. Horizontal. And cover the film.
And cover the film. Never changes. Always the same 3 things every single time. So what's my vertical?
The 0.
0 degrees. I'm going to take this. I'm going to go to 0 degrees. I'm going to reference the front. There it is, 0 degrees. Vertical's done. How do I find my horizontal?
The center line of the eyebrow or the nose. The center line of your teeth.
Say that again?
Center line of your teeth. Or eyebrow.
Closer. Closer.
The
Nope. Going once, going twice? Okay. We only reference the teeth that we are trying to take. We only reference the teeth that we are trying to take. In this case, it's the premolars, right? But it is the occlusal, I'm sorry, scratch that. It is the horizontal angle of those teeth that we're interested in. What direction is that horizontal going in? Okay, so we have to take a look at the second premolar, we have to take a look at the first premolar, and we have to take a look at the canine. Now, we said, and you can use your pens for a little while, but this only lasts so long, right? Because we can't take pens and stick them in the patient's mouth. But if I lean this up against those 3 teeth, or even 4 if I include the molar, and that's okay too, this is the horizontal angle of those 4 teeth. It's not going at this angle, it's not going straight, it is, if I lean that right up there, that is the horizontal angle. Now if I lost you right now, just feel free to let me know. We all have that? We all understand that? Good. The flat portion of this PID, if you had a pen that was going in the same horizontal manner, you're going to take that and you're going to rotate it to where that pen is parallel with the horizontal angle of those premolars. Did that make sense? Okay, that is the horizontal angle. I feel like I'm there. Now, I'm only doing one thing. I'm not, look at how far forward I am. Do I care? No, at this point, I don't care. All I'm trying to do is establish my horizontal. And the first one was the vertical. So we established the vertical, we established the horizontal. What's left?
Cover the film.
Covering the.
Cover the film.
Cover the film. So how do we cover the film? Well,
The sensor.
so yeah, how do we cover the sensor? The side of this has to pass or cover which tooth?
The canine.
We want to pass the canine, but we don't want to just cover it.
The incisor.
What incisor?
Lateral.
The lateral incisor. This side of this must go to your lateral. If you just stick with the canine, if you just cover the canine, you'll probably wind up getting a cone cut. So we have to pass it. By passing it by one tooth, it centers your sensor in the center of this PID. We okay so far? Okay. I got my horizontal. I got my vertical. I just cover the film from right to left. Now I want to make sure I'm not too high and I'm not too low. I'm going to line this line up with the bite of that patient or the bite wing tab, same thing. So I'm not too high, I'm not too low. We good? That's it. I've just done 3 things. Each one of those has a little thing you have to do in there. Vertical, you know, you got to put it on 0, you got to find out what that is, and there's going to be more to that later. Horizontal, how do you find your horizontal? It is the horizontal angle of the teeth you are trying to take. Once you find that out, then we cover the film. So here, I'm going to not go that way. I'm going to go around this way, and I'm going to go ahead and take that picture.
The study doesn't show the same premolars. This is the central.
Thank you. Okay. Oh, by the way, do you see how this is green right here? These little sidebars are green.
Yeah.
Okay, this sidebars green on this control or on the screen basically says that we're ready to go. The machine knows that we're pretty much ready to go. So let's turn it this way. So, okay. So these green bars mean that it's ready to go. This is telling us we are on the patient's right side, and it knows what it's about to receive here in just a little bit. So I'm going to go ahead and close this. I'm going to go ahead and press the dead man switch. It's on bite wings. It's on digital, so we're all good. Press and hold. And then I'm going to go ahead and walk back into the room. And your x-ray came up, okay? Now, sometimes this throws it in a really weird angle. Sometimes it turns it upside down. Sometimes it throws it in reverse. I don't want you to be concerned about that, like, oh, I took the worst picture in the world. We normally wait till we're complete before we go ahead and move on, okay? Because if you stop at this at any point, I will know that you stopped it, because this, right now it's blank, right? There's nothing else on the screen. But if you stop it, your film will then go to the perspective space of what we're trying to do, okay? It'll go to the patients to this side of the screen, the right side of the screen, and it'll do that. It wants to go back here, but we're not doing that. We're going to the molar, okay? Premolar, molar on one side of the patient's face. Be efficient. Stay on that side, complete that side, and then we can move on to the other side. Okay, so I'm going to have you guys help me with this one. I'm going to move around on the other side again. I'm taking the molar picture, okay? Now, I don't have to do very much. All I have to do is move this thing back. It's already inside the mouth, right? So now for a molar picture, what tooth do we have to include?
The second premolar.
More specifically, the second premolar. So you're doing exactly what you did before. You're just pushing this thing and tab a little bit further back, and you're making sure, identify your second premolar. Make sure you identify it. If you're not sure, ask, but start getting used to your anatomy. Okay, I can feel my finger that the tab or the sensor is completely covering that second premolar. I could just put my finger right here and go, oh, that's right in front. Then I'm going to go ahead and close down. Now, I do want to make this note. I'm going to actually take this back out of the patient's mouth. When you place the sensor in the patient's mouth, that sensor should be coming straight forward. We should never have it to where this is going this direction, where the sensor goes to the back of the patient's mouth and then returns out the front of the patient's mouth. It's going to look like you took the opposite side on here, and then you're really going to have you'll be frustrated really quick. So notice how that kind of bit also, it looks a little twisted. So you may have to sit there and kind of adjust it to where it's still centered, equal amount on top, equal amount on the bottom. Okay, in the patient's mouth, take that tongue and move it out of your way, because if it gets caught under the sensor, sometimes it wants to put pressure up. And you wind up with more of the maxillary than you do of the mandibular. Okay? And this patient is not working with me. Move over, patient. Give me that tongue. Okay. Okay, so now I'm feeling for that sensor. Is it covering the second premolar? It is. Bite down slowly, close all the way. Won't take my finger off until the patient is completely biting down. And now I can go ahead and grab this. How do I find my vertical? For now, it's on 0 degrees. I'm going to go back to 0 and place it on there just for our purposes here. And then the big question is, how do we find our horizontal angle? What's that based off of?
The bite of the
I'm going to hang out for a little bit on this one, because it's the same thing that we just did.
was the bite angle,
I want you all to write this down. On the back of your paper, somewhere in the back, I want you to write down how we find our horizontal angle. Come in further. Ready? Our horizontal angle is based off of the horizontal direction of the teeth we are trying to take. Whether that's premolar or molar, doesn't change. Okay, so I'm going to kind of point this towards the camera just a little bit, and then I'll show you what that looks like for these purposes. Okay, so I'm going to go back to the premolar for a second. If we were taking the premolar and we were trying to find the horizontal angle, we would take, we could use a pen as a reference for now, but we're going to wean ourselves off of it. The horizontal direction of the premolars using the molar, second premolar, first premolar, and the lateral. All four of those teeth collectively, the angle, the horizontal angle of those comes in like this. It doesn't come in straight, it doesn't come out like this. I'm leaning that horizontally up against the buccal surfaces of all those teeth, and that's the angle that I get. So I would take my PID and I would rotate that to where the face of your PID is in the same direction as that horizontal angle. But we're not taking molars. So the molars look like this. They're not at this angle, they're at this angle. These are the molars, these are the premolars. The molars, I'm putting this all the way up against the third, the second, the first, and I'm trying to consider that second premolar because I am trying to include that in there. That is the horizontal angle of those molars. Is this making sense? in comparison to what you guys just wrote down. Our horizontal angle is based off of the teeth, the horizontal angle of the teeth that we are trying to take. So now I'm going to take this PID, I'm going to rotate it to where the face of this is now parallel with those teeth, and I've just found out my horizontal angle. There's one thing left. Considering this when I just put this on here, I did my vertical, you guys helped me with the horizontal. What's left? Cover the film, or the sensor, right? Cover the sensor. And in this case, we have to remind ourselves where the front of our sensor is. So if the front of our sensor is on what tooth? What tooth is it?
Premolar.
Which premolar?
Or second premolar.
It's on the second premolar. The side of this cone must then go to what tooth? The first premolar. So, so I'm going to take this and I'm going to go, now don't get confused and don't rotate. I mean, at this point you work so hard for that horizontal angle, don't go, okay, because right now all I can see are those premolars and it might confuse you, be like, oh, I'm at the wrong horizontal angle, and then you move. So, so keep your horizontal straight, or how you set it, and then the side of this is going to go right to your first premolar, which is right there. Now I'm using my finger and I'm referencing the inside of my finger. If this cone was to extend, you have to ask yourself, where is it going to hit? Because if this cone is too far forward, you're going to get a cone cut on the back side, okay? And we don't want that. So right now we're okay. We're okay from the right side, we're okay from the left side, but we have to adjust the height on here. Not too high, not too low, the side of this. Now you guys tell me from your angle right there, and you kind of want to kind of crouch down just a little bit to see that. Am I too high or am I too low?
Too high.
I'm too high. So I need to take this and then bring it down to where it is right by that bite. Vertical, horizontal, cover the film. We just did all those things right there, and then I'm going to go ahead and go back to here.
To cover the whole first premolar or to the end of the first premolar?
To the mesial of the first. So I kind of say the entire first premolar to cover. Now, they're not going to see the first premolar in that picture. All they're trying to do is center it at that point. That's all they're trying to do. So then I'm going to go ahead and head on back over here. I'm going to go ahead and press that button. It will then show up on the screen. And it's actually upside down, you know. So I'm not worried about that, because when you're done, it'll actually orient itself to the way it's supposed to look. Thanks. Okay. So, so it showed up on screen. It's upside down. It's just the way that this machine kind of does it. So this is Dexis. I don't know if all the programs out there do this, but I know that Dexis does. But I'm going to stop this for now. So I'm going to then, and then you'll notice that when I do it, it'll throw the images onto the screen to where its perspective spaces were. Or not. There it goes. Okay. So then when it does that, you know, the goal today is to try to complete all of them, but if it doesn't, I'm not concerned about it. I just kind of want you to get your feet wet a little bit and getting this right side on there, and then we'll kind of work on the left. But you'll notice that on the premolar, we worked really hard on getting that canine in the picture, right? Is the canine there?
No.
It is there.
Oh, yeah.
And by the book, now on the book it asks for the mesial edge of your canine. I'm sorry, it uses the, well, it says, in the book it actually says the mesial edge, so you're getting the whole distal side. I don't know why it says mesial edge, but we're only getting the distal side. Even if I had a little piece of it, I'm pretty happy, because you're showing me the interproximal space. Okay? But look, everything's open. Interproximal, 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 interproximal. This side's a little bit closed, but it's not quite overlapping like something like this. Now, because that's overlapping on the molars, do we care?
No.
No, because this is a premolar picture. It's a premolar picture, so I'm not really concerned about that. okay? We're not concerned about molars in the premolar picture. We're hoping that that first molar is there, but you know, that's about it. Now, if we're looking at the molar picture, we worked very hard at trying to get that second premolar. Is it there?
Yeah.
Yeah. What part of it is there?
The distal.
The distal of that, and so we have the interproximal space. Very tight, a little overlapping, a little overlapping, a little overlapping. It's very minimal, but there's a little bit of overlapping in there. We're not too concerned if it's that tiny of a space because it's a diagnostic film, but if the doctor says that he or she wants that open, we have to try to work very hard at opening up that contact to the best of our abilities. We may or may not be able to do it depending on that patient, but we'll certainly try. But this looks really good, okay? We have, for the most part, an equal amount on top, equal amount on the bottom. This is a natural curve of that patient's right side. The further you go back, it starts to rotate up. It starts to rotate up. That is called a curve of Spee. That's somewhere in your exam, curve of Spee. That's going to go ahead and go up. What we're also looking for is the bone that supports these teeth in the area that we're looking for. Can I see the bone between here and here? Yeah, the bone is supported. I can see it right there, I can see it right there, I can see it right there. I'm not worried about what's coming in front of that canine. I just want to let you know. Now this is a little bit off. My margin got a little bit turned. Generally, I'm hoping to do this, but because all that area that I need is still there, it's still a diagnostic quality film, okay? Small error, but we get to see what we want to see in there. Same thing here, starting to rotate up. I'm starting to lose a little bit of bone right there, but we got kind of what we need to see.
So how would we fix that?
You may not be able to, other than trying to take your bite wing tab and to try to force it in that direction to where you kind of get more of a, but you won't be able to fix this because this is the natural curve. It just naturally goes up and that's just the way it is. Okay. Any questions? You okay? Okay. So here's what I want to do. Just so I want to get you guys to get in there. I want you to take a premolar picture on your patient's right side using all the three things that we just talked about. Find your vertical, find your horizontal, cover the film, and knowing and referencing the correct teeth. Any questions? Okay. If you need help, I'll be glad to help you on these, okay?